Breasts play a very important role in a woman's body image, self-confidence and beauty. A well-formed, symmetric and firm breasts boost a woman's confidence, whereas asymmetrical, small or large breast and saggy breast, they take their self-confidence and they feel embarrassed. They don't feel happy in themselves and that's why they feel like some part of them is lacking. Let's talk about breast today. I am Dr. Smriti Nathani, plastic and cosmetic surgeon, practicing at Tamira Plastic Surgery, Chennai. So as I said, large or very small breast can be a major concern for a woman's body image. And let's talk about how we can address these problems. Very common problem which women come to us is after pregnancy and after the breastfeeding, usually the breast become very saggy and droopy and they lose their firmness and tone. How to correct that? Because they want to go to their previous breast size which was firm and which was nice, but now due to the changes, hormonal changes and all in the body, the breasts become very saggy and they don't look as good. Only for that they have to go for a push-up bras or support bras, and they don't want to wear those kind of bras, they don't feel good in their dresses. They also want to maybe have to go for a larger dresses size because they feel like according to the frame and their body, the breasts look little larger as they are droopy, and so they have to go for looser dresses rather than the perfect fitting dresses. How do we address this problem? Why does this happen? So due to the hormonal changes during the pregnancy and childbirth and all these things, the breast does become saggy and droopy, and what happens is the skin stretches and it does not go back to the normal pre-pregnancy state. So that's why breasts are always hanging and lose their firmness. How can we address this? Is by breast lifting or by breast tightening surgery, which is also called as mastopexy. How do we do mastopexy? So it depends upon how much of the level of sagging is present, how much of the skin excess is present, and how much do we want to lift them up. So for lifting, there are various ways in which the breast lift or mastopexy can be done, depending upon the type of scar which is desirable and upon the type of or amount of skin excised. There can be, scar is something which cannot be completely taken away in a process of mastopexy or a breast lift. What can be done is giving you a very minimal and nice looking scar which is obviously hidden and it's not seen very obviously. So the scars which we are usually gotten in the process of mastopexy are the donut shaped scar, which is just around the areola, that is your nipple and the dark part, which is nicely concealed in your nipple area. Second is the vertical scar, which is from the nipple going down, and that's one line which is very fine and hides out and softens with the time. Third is the anchor scar, which is when the breasts are very heavy and saggy, then we have to excise extra skin, and for that you have a vertical scar and then a horizontal scar in your under boob, which gives an anchor kind of shape to the scar. Are these helpful and are there any side effects? Yes, talking about the effect of these surgeries are very helpful, not only physically but also mentally. Because I have seen in my patients how it has changed their lives and they get their confidence back. Breast lifting, we cut the skin accordingly, how much of skin is required to be cut in the manner which has been decided with the patient previously. Then the inside of the breast tissue is lifted up so that it secures a place and it stays like that, and then the skin is stitched on the top like a brazier. You can imagine it as how you put a brazier and the breast look lifted, exactly how it looks after a mastopexy or a breast lift surgery. There are no side effects of breast lift surgery. We have to, however, cut a little part of your breast from your downside to make it smaller and lift it up. Apart from that, there are no life-threatening or any kind of side effects and which are noticed after these breast surgeries. Second very important topic of concern is big breast. So heavy breast which are not in proportion with the women's body and the frame, which they look small and petite but the breasts are always large. They cause a lot of emotional and also physiological problems and psychological problems. Physiological problems which are usually faced by very heavy breast are postural problems. Always there is a neck pain, back pain, chafing of the bra straps, and then under boob always there is some kind of infection, chafing and all these problems going on. Psychological problems associated with this is the embarrassment, and also, as I mentioned, women always have to go for a larger dress size. They are unable to wear the size of their body. How can we treat these? So this is treated by something called as the breast reduction surgery, or it is the surgery where we make the breast to the size which is perfectly fitting to your figure and the frame and does not look large or small. What do we do to do it? So this is done by the surgery where the breast portion from your underside of the breast is trimmed and it is brought to appropriate size of your body, or after discussion of the patient, like which cup size they would like to prefer. After the discussion, patient is taken up for the surgery, and we do cut a little amount of the breast and then readjust the skin accordingly. Again, the scar is there, but it is hardly visible because the complete scar is invisible underside of your breast and it is not seen while in the standing position. So this is another surgery which is very rewarding, not only emotionally, psychologically, but also physically. Big breast also cause a lot of problem when the women wants to go for exercise. They cannot do exercise, they cannot wear sports bras. And the biggest problem which I have heard with my patient is wherever I go, people look at my breast, and this is a very, very embarrassing situation. So this is how breast reduction surgery is again very rewarding and very simple surgery. It is a daycare surgery where you come in the morning and get your breast treated and go at home. Obviously, there is no big downtime after the surgery. You are good to join your work in 3 to 4 days of time, and there is no much pain associated afterwards. Talking about very small breast. Very small breast, which are again, the body is there but the breast is very, very small, and they did not feel good when they wear tight fitting clothes and all because there is no projection. So again, women are very depressed about this situation as well because the breasts are almost deformed, very small, or not at all, as your age, they are not at all grown. What can we do in these circumstances? There are two options, how you increase the breast size. Very famously sought question, people ask me, can I increase my breast size if I use any kind of medicine or oil? The answer is a straight no. No medicine or oil can increase your breast size. They can only cause a little inflammation temporarily where you will feel that, okay, the breast is slightly looking bigger and maybe if I continue using these, the breast will become bigger. Sadly, it is a no. These medications or oil can only cause you side effects and problems. How we can increase the breast size? One is my breast implant. Second is by fat grafting. Talking about the breast implant, implants are very safe alternative. They are quick, easy, and very safe alternative for increasing breast size. After discussing your surgeon, you can get to an idea of how much of the breast size increase you want and how you will be able to achieve it. Implants come in various shape and sizes to give you a very soft, natural look and also the feel. So that even you, when you are having the implant, the feel will not be changed completely and you will feel as if it is a natural breast. Apart from that, if there is only a moderate size increase required in the breast, then I would suggest an option of fat grafting, where the fat is taken from your own body, processed and injected in the various planes of your breast so that the breast size looks bigger. So basically, the fat is pumped in the breast to make it big. This, however, if you want a major increase like 2 cup sizes or more, that can be achieved by fat transfer, but you will need various sessions, maybe 2 or 3 sessions, because there is a limit up to which at one time how much amount of fat can be pumped into your breast. Because if we pump lot of amount of fat in your breast, the fat will not survive because it also needs blood supply for survival. In fact, it will start dying, which will cause problems and complications of fat cyst, oil collection cyst and whatnot. So, recommended is breast implant, which is very good and safe alternative. It does not hinder with your breastfeeding after pregnancy. It does not give you unnatural feel or look. It is not at all life-threatening. And it can be changed into size or whatever if you want after long term. But if not, there is no need of changing it even after 10 to 15 years of breast implant. However, with the fat grafting, if you are not okay for the breast implant, you can go for fat grafting with a limited increase in breast size. But again, that is your own body fat used, and again, it is no complications and gives you a very long-term good results. So these are the most common sought questions for breast surgery, and it is a very sensitive topic for women and also with the men. So, whenever you have any problems related to your breast size or any queries related to these surgeries and procedures, because I see there are a lot of misconceptions and confusions going around when people search on the internet. So, please reach out, hit the like, subscribe and follow button, and call us and schedule a consultation where I can talk to you and suggest you what is best for you and your breast health as well. Thank you so much for listening.